neuropathic pain. It occurs when the nerves that carry sensory information from the body to the brain become damaged or dysfunctional, leading to abnormal pain signals being transmitted. So, what is neuropathic pain? It's characterized by a range of symptoms including burning, shooting, stabbing, electric shock-like sensations. It can be constant or intermittent and is often described as intense and worse at night. Unlike other types of pain, neuropathic pain can be triggered by mild stimuli such as a gentle touch or a cold breeze, due to the altered sensitivity of the affected nerves. It occurs when the nerves that carry sensory information from the body to the brain become damaged or dysfunctional, leading to abnormal pain signals being transmitted. Neuropathic pain is a complex and often debilitating condition that affects millions of people worldwide. Hi, I'm Gideon from Pain.PAUSE.LIVE, licensed psychotherapist in Germany, specialized on the treatment of chronic pain patients, honored with the German Pain Award for Science and Pain Medicine in 2022, and a chronic pain patient myself. In this channel, I want to inform you on a personal and scientific sound basis about chronic pain. A short notice before we start. This video is intended for educational purposes only, and not as a substitute for psychotherapy or medical treatment in any way. If you suffer from symptoms like constant pain, please consult a doctor. So, what's happening in neuropathic pain? As I said before, neuropathic pain occurs when the nerves are damaged or dysfunctional, causing them to misfire and send abnormal pain signals to the brain. The damaged nerves can distort existing pain signals, create a new pain signal, or prevent the usual pain signals from being transmitted properly. Just a short question on the side. Are you interested in learning how to reduce stress and tension when in pain? Get your first easy to learn exercise for free by clicking on the link down in the description or at the top of the comments. Some common symptoms that may indicate neuropathic pain include severe, intense pain that feels like burning, shooting, or stabbing, electrical-like sensations, numbness or tingling like pins and needles or ants on the skin, increased sensitivity to touch or temperature, skin that appears mottled or red, and itchiness. Neuropathic pain is often described as different from other types of pain. It can be more intense, debilitating, and difficult to treat with traditional pain medications. If you experience these types of symptoms, especially if they persist over more than a few months, it's so important to consult a healthcare professional for proper diagnosis and treatment. The causes of neuropathic pain. Neuropathic pain can arise from various underlying conditions or injuries that can affect the nervous system. These include diabetes, we call it diabetic neuropathy; shingles, we call it postherpetic neuralgia; spinal cord injuries, chemotherapy-induced nerve damage, multiple sclerosis, stroke, trauma or injury on the nerves, and of course, and we always forget about this one, alcohol plays a huge role. So, how do we diagnose neuropathic pain? Diagnosing neuropathic pain involves a comprehensive evaluation by a healthcare professional, typically a neurologist or pain specialist. These processes include, first, taking a medical history. The healthcare provider will gather information about the patient's symptoms, their onset, duration, and any potential underlying conditions or injuries. Second, physical examination. A thorough physical examination is performed to assess the affected areas, identifying any sensory abnormalities, and rule out other potential causes of pain. Third, diagnostic tests. Various tests may be ordered to confirm the diagnosis and identify the underlying cause, such as electromyography, EMG, and nerve conduction studies, nerve or skin biopsies, imaging tests like MRI or CT scans. It's crucial that these tests are performed accurately and interpreted correctly by experienced professionals to avoid misdiagnosis. Now, what are the treatment options? The treatment of neuropathic pain often involves a multidisciplinary approach combining various therapies to alleviate pain and address the underlying cause. Some common treatment options include: first, medications. Various medications may be prescribed to manage neuropathic pain, such as anticonvulsants, antidepressants, and topical creams or patches. It is important to note that these medications primarily target the symptoms and not the underlying cause. Non-pharmacological therapies, complementary therapies like physical therapy, biofeedback, and acupuncture can be beneficial in managing neuropathic pain. Third, lifestyle modifications. Addressing underlying conditions or risk factors such as diabetes, vitamin deficiencies, or alcohol consumptions through lifestyle changes can help alleviate neuropathic pain and improve overall health. Fourth, interventional therapies. In severe cases, interventional therapies like nerve blocks, spinal cord stimulation, or intrathecal drug delivery systems. It's essential to work closely with a healthcare professional to develop a personalized treatment plan that addresses both the pain and the underlying cause while considering the patient's individual needs and preferences. Remember, seeking professional medical advice and guidance is crucial for managing neuropathic pain effectively and improving overall quality of life. But don't stop here. Get further information on the most common type of pain, nociceptive pain, by clicking on the video here. And if you liked this video, don't forget to give it a thumbs up and subscribe to my channel. See you stepping into life.